can we start? Thank you very much.
The operating theatre, a place of hope and fear.
You've been so brave. Rest your head back, sweetheart.
Some of these patients come in, they're really scared.
You're not okay, because I can see it in your face.
We're back in day surgery at the Queen Elizabeth Hospital,
Where's the Queen?
where the theatres, beds and staff have been rigged with cameras.
We work wonders here.
We use humour in theatre.
So you win some more local anaesthetic.
Capturing familiar faces hard at work.
No karate in here today.
Bless her, look how little she is.
Love you.
Performing complex operations.
You never know what you're going to get. It's exciting and I absolutely love it.
Is he alright? Is he breathing?
And changing lives.
Stand clear, please.
Inside the operating theatre.
I've never had anyone who said they haven't enjoyed it.
I like to work with my hands. I like to do things. I'm more of a skilled person rather than an academic.
So the plan today is to see if we can manipulate his nasal bones back into a better position. Hopefully we'll just be able to do it with the old thumbs.
I'm someone who's always enjoyed doing things with his hands, from building airfix models to sketching and painting. I turn my hand to most things in the home, usually without too much destruction.
So this gentleman's unfortunately had a fall. I do some DIY. I tend to overcomplicate things. His left nostril, no septal hematoma, so that's good, okay. Painting and decorating, for example, I'm a dreadful perfectionist. Ta-da!
Oh, that looks fantastic.
Yeah, look at that.
Hi, got an appointment for surgery. Connie McCrindle. Okay, thank you. Because I am a nurse, you know too much sometimes, and it's best sometimes to be ignorant, so a bit apprehensive. Sit back, relax. You can overreact your feelings because you know what exactly is going on, you know what can happen. Sometimes ignorance is bliss.
Connie McCrindle.
What I want to know is what it is. If there's something else, at least we know it's there and we can deal with that thing. It's the uncertainty, really. Thank you very much.
I'll be right over just to see you in a little while, okay?
Thanks. We met when he was in the army and I was in the Air Force out in Bosnia, and that was back in 1993, I think. We've been married 22 years now. And I've just got to...
See, there's your gown, you see. That's what I was thinking. It might... So your bum will be showing. That's why I said bring your dressing gown. I was a combat medic in the army. I got sent to Bosnia, and she was a Royal Air Force nurse. There was nothing worse when I was walking down the corridors at hospitals. You saw people go to theatres like that. Everything's hanging out. Obviously, being a nurse in the Royal Air Force, predominantly around males, she's had to be quite strong.
Connie, yes.
Connie, yeah.
Yes. My name's Louise, I'm one of the nurses here today.
Hi, Louise.
I'm just going to go through all your paperwork with you, if that's all right?
Yeah. I developed the menopause when I was 35, so that was quite young. And then probably over the last sort of 12 months, had the odd spotting of bleeding, which I ignored, which was wrong. And basically bloating as well, which made me consider that there was something else going on. Had a scan last week and they noticed there was thickening of the lining and some polyps inside the uterus.
Connie's going to have an operation to remove the polyps and check there's nothing more sinister causing the bleeding.
And I am a nurse, so she's all
Are
right.
you? Oh, brilliant.
We both are, so it doesn't,
Oh,
it doesn't
brilliant.
worry us.
Do you know what though? We can go either way, okay?
What?
Because if I'm in hospital, I am the worst patient in the world.
She is.
Me too.
She's awful this morning. She's been terrified.
Oh, bless your heart.
Because she knows she's thinking
'Cause I
too deep.
I know what goes on.
Yeah, exactly. The more you know, sometimes the worse it is.
It is, yeah.
Connie.
It is, yeah.
Crindle.
That's right, yeah, the right one.
Let me get out of the way.
Oh, you're okay. You can have a seat. I'll sit on the. I'll sit on the.
Are you allowed to?
Yeah. Only I'm allowed to.
He's allowed to.
That's what
no
the
one
nurse
else
said.
can. Yeah.
Hi, my name's Robin. I'm the anaesthetist.
Hi.
Have you had anaesthetic before?
Yeah.
Any problems?
None.
No problems. Okay.
I've had an anaesthetic before. I've had 2 in the past because I've got metal plate in my neck. I've got prolapsed discs all the way down. That was part of jumping in and out of helicopters.
And how much
No, I
problems
can
do you
get.
get with your neck at the moment?
I can do.
So you got pretty good movement. How
Yeah.
about down? Okay, forwards and back. Okay, that's pretty good.
Yeah.
That's pretty good. Okay.
I was involved in the Falklands and then the Gulf and then Bosnia. My main role was with helicopters and mainly the injured, and it was getting them back to a safe area. That was my war role, jumping in and out of helicopters, scooping up bodies, taking them forward.
Connie's surgeon is consultant gynaecologist Mr. Azoma.
Hello,
Hello.
is it Connie?
It is, yeah.
How are you today?
I'm fine, thank you.
Okay, so you know why you're here today?
Yes, I do, yeah. Having polyps removed from
Polyps.
the endometrium.
Okay.
Best case scenario, I'd like to stop bleeding. That's one of the things I would like to stop happening. I'd like the bloatiness to go away, because women are conscientious about the weight and how they feel. And again, when it's round the middle, it doesn't make you feel like a woman. It's a strange feeling.
Okay, so you had a scan and they think the lining of your womb appeared a bit thick?
Yeah, yeah.
All right, so we're going to put a camera and have a look.
Uh-huh.
Take a sample, and if we see a polyps are like small skin tag and we can safely take it out,
Uh-huh.
then we'll take it out.
Okay, yeah.
Okay?
Hello.
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 Hello there.
Have you come to take this moaner and whinger away from me?
That's not very nice. But yes, I have come to take her away. I'm Sue, by the way.
Hi, Sue.
Thank you very much. Okay, shall we go?
Yeah.
Have fun.
Have fun.
I don't think it's fun.
No, I don't think it's fun either. Everybody would say this, that if you had got a polyp and if it was cancerous, the worst case scenario would, you would have to have a hysterectomy. But you just have to go with what's put in front of you and accept your diagnosis and continue.
Hello, right? Bradley Bell.
That's great. Have a seat, please.
Lovely, thank you. Cheers. I can't wait to have it done and stop having the scratching and stop having to get in the shower and burn it.
Is it Mr. Bell?
Yeah.
Hi, come on in.
All right.
My name's Kezia. I'm the nurse that'll be looking after you today.
All right, I'm Brad.
Hi, shall I grab you a chair?
It makes me laugh because he doesn't actually itch him. He gets in the shower and puts it on the hottest and burns his leg. And he says it feels lovely. It's very strange, but it's really comforting for him.
Take a seat, get comfy. I'll just draw the curtain and we'll go through your paperwork and get you all admitted.
Okay.
They don't really affect me, and they're a part of Brad, but for his self-confidence, I suppose it's better for me that he's more confident because he's happier, so I'm happy for him to go ahead and have it done.
So you've come in to have your varicose vein sorted out?
Yeah.
On your left leg?
Yep. So about 10 years ago, I started with like the brown patch, and then the doctors, they said to me that all the discomfort and the eczema is caused by a varicose vein, like varicose eczema or something, I think it's called. This is actually where it started, just that little mark there, and then next thing is just spreading over my leg. It's kind of going at the back of my leg there, and all down here as well.
How long is the operation?
Not too long, probably about an hour and a half.
Well, that's not bad, is it? That's really quick for longer than that, yeah. I'm quite anxious about it. I don't really like blood and veins. I'm probably not the best person to have with him, but I'm trying to be supportive. I think they take the vein tight in a knot somehow. I don't even know, it makes me go all funny thinking about it. I'll probably scare Brad to death. Has he got over the weekend? Like, has he got to lay up, elevate it or anything? Or?
Yeah, it's best not to be standing up for too long periods of time, especially standing. Don't be afraid to move around. You can, potter around the house. Just don't go on any long walks and no sort of standing at the kitchen sink doing the washing up.
There's no chance.
Just for a little while. I think that's everything. If you do think of anything you want to ask, just give me a shout. I'll be looking after you all day.
Thank you.
Right.
All right, thank you.
That's okay.
Cheers. Met Kirsty through my brother. She was like a friend of my brother's, and yeah, he set us up, and 6 years down the line, still together and married with 3 kids.
What originally attracted me to Brad was obviously his looks. We just clicked. On our first date, I think we both just knew we was going to be together. We just talked and talked and talked.
Freezing on?
No, it's not cold in here. You've got a jumper on.
I'm not nervous.
It's all right, Brad.
I don't actually think I am nervous. You don't think I tell you?
Everyone gets nervous.
Right, welcome everybody.
Brad's surgeon is Mr. Redwood.
Right, okay, so we've only got one patient, the other one's cancelled. We're left with Mr. Bradley Bell for left high tie strip and multiple stab avulsions. Usually, if they have a general condition causing eczema, they'll have eczema on the other parts of the body. If they just have it on the leg that has the varicose veins, you can be fairly sure that that's the cause. There's no surgical concerns as such. We just need the hooks, the stripper and some local anaesthetic. Okay, excellent.
So dry, isn't it?
Say goodbye.
Are you ready, Bradley?
Yeah.
Follow
Yeah.
Zoe then.
Okay.
All right.
Love you. You'll be fine.
I haven't had any operation before. Only when I broke my arm. I'm feeling, a little bit nervous.
Hello, Boo. You look like an extreme diver.
I am. This is my part-time job.
Hello. You two look like you belong on Star Trek.
Brother goes mountain biking with one of these things.
You look very nice, and you just look awesome. I know. You can go parachuting after this.
Right, come on in.
Right, lovely.
Right, this is Connie.
Hi.
Hi there, my name's Claire. I work with the
Claire.
anaesthetist.
Yeah.
Can you take your dressing gown and your slippers off for us? And then if you hop yourself up.
Connie McCrindle is about to have an operation to remove polyps from her womb, which will be tested for cancer.
Now, we need to pop a drip in the hand.
Yeah.
It's what we use to give the anaesthetic. So I'm just going to give you a forearm squeeze.
Right. Okay.
Just open and close your hand like you're grabbing something.
I would like everything to be fine. And the polyps are benign. And just to go back to my normal routine.
Just think the nice cup of tea you can have when you get out.
I think what we're looking for from today's surgery and this polyp removal is just hopefully to find out when they've tested it that there's nothing there.
Right, small scratch. Right. We're going to give you a bit of oxygen to breathe, okay?
Just breathe away normally.
So we're going to slowly drift you off to sleep, okay?
I do straw.
Okay, that's okay, we're used to it. What is that, a 4? Or 3? 4 of? It's 4. Be very careful with her neck. That's better.
Okay, shall we proceed? This procedure called hysteroscopy, essentially putting a camera in through the neck of the womb, having a look inside to see if there's any abnormalities. Small polyp.
A polyp is an abnormal tissue growth that looks like a skin tag.
Polyp. Can I have a open forceps?
Mr. Azoma removes the polyp to be sent away for testing. But he needs to reinsert the camera to look for anything sinister.
They can undergo malignant changes, and that's when they can become very life-threatening. If I come across a very suspicious area, I have a high suspicion of a cancer, of course I think about what the patient is going to go through, how this is going to affect their lives and their family. Yeah, that goes through my mind all the time. Is there a lot in there? Okay, that's it. All done.
Brad Bell is about to have surgery to remove varicose veins, which have troubled him for 10 years.
I'm hoping this operation will make him more confident to be able to just go out in the summer, wear shorts, not think everyone's staring at his leg. Yeah, just give him a bit more confidence really. And also the itching, it won't be bothering him.
Everybody here who needs to be here? Excellent. Can we start? Thank you very much.
Mr. Redwood is Brad's surgeon. He's assisted by long-term colleague Katie.
Did I tell you about me and Tony going on a
murder mystery train from Sheringham to Holt.
Oh, right.
That was brilliant. That was
it
a
good?
James Bond theme. That'd be right up your street. You like a bit of James Bond.
Yes.
Miss Pennymoney did it. Yeah, because she was in love with James Blonde.
Sorry, no. Right, could we have
Ready
the leg
when you are.
lifted, please? There we go, I think it's down. There it is. It's fine. I'm fine. Yep, self-retainer, please. He had a cut up in his groin where we find the surface vein just before it dives down into the deep venous system. Good. Excellent. Right, I think we can tie that now. Yeah. So is it going to go down and is it going to strip in one? What you have to do is hold it up. There you go.
Mr. Redwood is trying to thread a plastic wire through the length of the vein.
Yeah, it doesn't want to go much further than this, as you can see. You can see it here.
Yeah.
Just keep it lifted. I think it's gone down a dead end.
I love my job. The actual delivery of the anaesthetic, I think, is amazing. Knowing how those medicines and those techniques work with the body just makes every day almost like a science experiment. Hi Carol, my name's Ben, one of the anaesthetists. I'm going to put the drip in and we'll get underway, all right?
Yeah.
Perfect. I chose anaesthesia as my job when I was a junior doctor. I was thinking of being a surgeon, and so I spoke to my senior and he said it probably wasn't for me and actually I should look at being a nice guy anaesthetist.
Dr. Fox's next patient is Carl Pleasance.
Good morning. Hello, morning. Is it Carl? Yeah, hello, morning.
Carl needs an operation on his knee to repair torn cartilage. He got the injury 3 years ago while working in the garden. It's left him in constant pain.
At the moment, the knee stops me doing day-to-day things like walking long distances, climbing stairs. I take painkillers every day for the pain.
Hello
Hello,
there.
mate.
Dr. Fox, you can call me Ben.
How are you?
I'll just pull up a little stool and we'll have a chat. I understand that basically getting around is somewhat reduced because of pain in the knee, is that
3
correct?
years I took to get it to here.
Yep.
6 doctors I've been to see, GPs.
Yep.
And that wasn't until the last one sent me actually to the hospital.
Yeah.
Carl's going to have his knee repaired by keyhole surgery. It can be done under general anaesthetic or with a spinal block applied to the specific nerve.
So we pop our needle next to that nerve and put local anaesthetic all around it. And that can then allow the patient to have operations wide awake or with some sedation, but it also allows patients to go home the same day. You actually put in a very small amount of local anaesthetic to give quite a profound effect. And I just find them quite fun because I'm a bit of a geek. So it's numbing injection in the back. The beauty of that one is it's not numbing the whole body.
Yeah.
So it's more of a focused anaesthetic. And what's quite nice is that we can do the procedure, no pain. You won't see anything gory at all. But Mr. Jeffrey's basically doing a keyhole procedure where he sees a little television screen. We have a separate second screen that you can look at as well.
That's no problem.
And as I said, it's nothing gory. It looks like an underwater documentary, if anything.
Brilliant.
Does that sound good?
Brilliant, mate.
Cool.
Thank you very much,
See you
mate.
in a bit.
Appreciate it.
Okay, so Carl is having a meniscal resection. I believe he's having it done under spinal anaesthetic.
He is,
So
yeah.
we're going to show him the inside of his knee.
Cool.
He should enjoy watching that. We'll
Yep.
explain the procedure to him as we go along.
Morning.
For you. Okay.
Absolutely marvellous.
Check the wristbands, Carl, and the other one as well.
Right.
There we go.
Pop your feet on there. Pop this on your lap. And drape your arms over the top of it and give it a hug. That's lovely.
Perfect.
Right then, chin on the chest.
Nice clean towel on the back. Righty ho. There'll be a little scratch and sting, okay? Are you right there, Carl?
Yep, no
Good man.
problem.
Perfect. Here we go. 1, 2, 3. Don't worry about if you jump. Sting, sting, sting.
You get a bit of a back wax when this drape comes off. That's Ben's fault.
Yeah, this is my phone. Now, do you want this quick or slow?
Do it quick, go on, mate.
There we go.
Marvellous.
The spinal block starts working almost immediately, and after a few minutes, Carl will be completely numb from the waist down.
Are you happy if we go through?
Yeah, more than
Sort of
happy.
get them to
Yeah.
relax, I think they're
Yeah.
still-
Yes. Form 4222.
Yes.
Yeah? Long while ago.
I think our oldest patient on record at the moment is about 106.
And if you have a seat just here for me, Cyril.
The older gentlemen always have a head full of stories which they can just reel off and tell you, don't they? Yeah.
I asked a lady once why she looked so young she was in her 80s, what kept her looking young, and her reply to me was plenty of sex.
Connie McCrindle has just had surgery to investigate whether she's developed cancer in her womb.
Recovery? Hello? Open your mouth for me. There we go.
All finished. Well done, Dr. Haig. Okay.
Right, it's all finished.
Thank you very much, Dr. Haig. All right, my lovely. Tiny little bit of oxygen. There we go. It's all finished, Connie.
Oh.
It's all gone well. The kettle's on for you.
Even better.
Even better.
Hello,
Hi.
how are you?
I'm fine, thank you.
All right, so operation went okay. Yeah, we didn't have any problem, just a small polyp,
All right, okay.
which we saw. We've taken that out.
Uh-huh.
Otherwise, every other thing looked perfect.
Okay, yeah.
Okay, so hopefully in the next few weeks, your doctors will write you with that report, the histology report, but it looked innocent to me. All right?
Why was the uterus quite thick inside, though?
Well, that's on scan, okay?
Yeah.
Scan looks at shadows and bounces of sound
Right,
waves, and
okay,
that's what it
okay,
interprets,
yeah.
all right?
That's
But it
fine,
all
yeah.
looked nice to
Oh,
me.
good.
All the best, and as soon as you're
Okay.
feeling okay, you should be all right to go home.
Okay, many thanks. then.
All right, take care.
Okay then, bye.
Lovely. Thank you very much, sir. There you go. Sorted.
Sorted.
All sorted.
All sorted.
Yeah. Marvellous.
Brad Bell's having an operation to strip a varicose vein out of his leg. His surgeon, Mr. Redwood, is trying to thread a plastic wire through the length of the vein.
It's gone down a dead end. Let's just... There we go. Bit of off-roading. Look at that. Look.
Yeah, look at that.
Got it round the corner.
Fantastic.
Okay, let's just have a little stab.
Mr. Redwood makes another incision near Brad's knee to retrieve the other end of the wire.
Right. Okay, if you just hang on to this now, lift it up fairly hard so I can see where we're going to put the local anaesthetic. Right, so your job is with your thumb, when you see a dimple, press on it. Yep. Yep, so there. Okay. And there.
It's going to be a corker.
Oh, don't say that. It's now going to snap.
No, I'm laughing in the face of it. That's it. It's going to be a corker.
Ah, that needs two. Really, really firm there. Just make sure that isn't snagging. Ah, this isn't good. Damn, that's just here where it's the damn thing's gonna. Okay, press really hard. Yeah, it's gone, hasn't it? There you go.
Oh, there were two. One.
Oh, look
Told
at this.
you.
Okay, and the vein is now turned inside out. You can see some of the side branches and valves and things. So clip, please.
There you go. Look at that.
Look at that. Okay. Yep. Scissors, please. There we go. So there we go. One vein.
Okay.
Yeah. So we've got it all. It is extremely satisfying to get it out in one go, and that does happen most of the time. Even though I've been doing this for over 20 years now, I still get the enjoyment from it when it all goes exceedingly well. So we'll just leave that. Just press on that. That's fine. So let's close the hole. Thank you.
Oh, good. Is he still out of it, is he, or is he in the after room?
I'm not sure if it's in recovery yet.
Okay.
Sometimes it takes a little bit longer to
Yeah.
what you've got to do.
Yeah, thank you.
Brad? Operation's all finished, you're just in recovery. Just lift your head for me a little bit. Lovely. Is there anyone on the ward waiting for you?
George Foreman.
George Foreman? Is he cooking your dinner?
Yeah.
He's out there cooking you a chicken breast on his grill. What do you do for work?
Gas engineer.
Ah, not a full-time comedian. Right, let's go in search of George. Karen, if he's not there, it's your fault.
Yeah, you better be, yeah.
He's desperate for George Foreman.
You alright?
Yeah.
Yeah?
You nutter.
Right. All right, you take care of yourself.
Thank you.
I'm going to go and hand over.
All right,
okay?
thank you. Cheers.
It's so good.
I went to bed early last night. I was awake at 4. Great. I'm waiting for Olivia to wake up.
So you was wake up for them to wake up?
She has this dreadful habit now of standing at the door. And there's a night light that goes on as they walk past, they don't fall down the stairs. So she's silhouetted behind this light and you're like, Jesus! Look at it! What? Come and drop me your daddy and you just stand there. The zombie at the front door.
Bless her.
Carl Pleasance is having keyhole surgery to repair the torn cartilage in his knee. He's been in excruciating pain for 3 years.
You right there, Carl?
Yeah, brilliant, mate. Thank
Good
you.
man. And anaesthetic was all right?
Yes, brilliant.
Yep. Can you see that screen nicely?
Yeah, brilliant, mate.
Cool.
So the operation will take about 15 or 20 minutes to do, so not too long. Good, so if you look at what I've got here, do you see the camera?
Yeah.
So we're going to pop that in your knee, and if you look now on the TV screen, you'll see exactly what's going on inside your knee. So if we have the lights down now, there we are.
Carl has been given a spinal block, so he's numb from the waist down.
So, this is your tormida meniscus. This is what we're interested in, and this is what we can trim up.
Is that what the problem is it?
Yeah. The meniscus within the knee is a shock-absorbing bit of cartilage. When a tear occurs, a loose flap of cartilage can get caught, and this gives a sharp catching pain, which really can be quite excruciating. So what we're going to do is trim all this ragged old stuff here. Okay. That's good. And just going to trim it a bit more. There we go, that's going well. So it's a bit like having a haircut with all these sort of loose, raggedy ends being trimmed. A nice short back on the sides and the knee. Okay, that's good. And then if we can just pop that back in there. Hoovering all these little bits out. Years ago, barbers and surgeons did the same job. That was a couple of 100 years ago. I think I might not have been a bad barber. You finding it interesting?
Yes, definitely.
There we are. We're pretty much done here, so...
Comfortable?
Yes, thank you.
Yeah. Warm enough?
Yes, brilliant.
Good.
And we are done.
Thank you very much.
Okay, I do love doing this under spinal anaesthetic, and I've never had anyone who said they hadn't enjoyed it.
Yeah, thank you very much, everyone, for doing this for me. No, that's appreciated. So I'll thank everyone now while you're all here. That's easy, isn't it?
Well, we enjoy what we do.
That's appreciated.
Good.
Okay, Carl, we're just going to go to recovery now.
Yeah, thank you very much.
Hello, day surgery. Rachel speaking. Can I help?
Less than 2 hours after his operation, Carl is almost ready to go home.
Hello, mate.
Hello, how are you doing?
Not too bad. Not too bad.
Yeah, you're looking bright and lovely.
Yeah.
Perfect.
Oh, thanks for your help earlier on.
Yeah.
Appreciate it, mate.
Yeah? All good?
Yeah. And I now can start feeling
Start feeling it? Yeah.
and everything.
If it's a bit sore, cocodamol later on.
Yeah.
And I'm more than happy that's a good painkiller.
Yeah.
Yeah.
Yeah, I've got a month's supply of them.
Fantastic. That'd be more than enough. And
So,
yeah. It really does give you that warm, fuzzy feeling where a patient gives you like a thumbs up and they're smiling.
no, thank you very much.
Perfect.
That's all been appreciated.
Awesome.
No.
Lovely.
Thank you.
All the patients that can go home, we like to have them home.
All right, yeah.
Out of here at 8.
Yeah.
Oh, here she comes.
Okay.
I can hear her.
You could hear her. How rude.
After having surgery to remove a polyp from her womb, Connie McCrindle is recovering well from the anaesthetic.
She's been good.
She's being good, yeah, right.
What are you on about?
Can we have that in writing?
She'll now have an anxious wait for the results of the biopsy.
What about you, mate?
No,
Stop.
yeah.
I'm going to go and grab your coffee.
All right, lovely.
Lovely
Yeah,
meeting you,
thanks.
Connie.
Lovely to meet you.
And you.
Yeah, lovely.
Hello, dearest.
Hello.
Oh, my stomach's killing me.
Is everything all right?
Yeah, he says removed a polyp.
Mm-hmm.
and took some, what do you call it, lining, or just scrapings of it.
Yeah, that's right.
Yeah, they just send it off for a histologist.
Of course they do. Okay.
Oh, it's killing me. I feel scrape me inside out.
Best case scenario is simple polyps, take them away, everything heals, and that's that, forgotten about.
Two hours after leaving theatre, Connie is ready to go home.
Okay.
Free. Lovely.
Perfect. Look
Thank
after
you very
yourself,
much
okay?
indeed.
No
Thank you.
problem.
Thank you ever so
Bye-bye.
much. Bye.
You all right now?
Yeah?
You feeling steady on your feet?
Yes.
Good.
Brad's operation to remove his varicose vein was successful, and after 2 weeks, he was back at work. Unfortunately, Carl is still in pain after his knee operation. He's now been referred to a specialist for further treatment. And after having the hysteroscopy, Connie's bleeding has stopped, and her biopsy thankfully came back clear of cancer.